Okay, so I did my presentation on cystic fibrosis. Cystic fibrosis is a hereditary genetic disease that causes the body to produce thick, sticky mucus that can obstruct the lungs. And I found that both parents, both mother and father, have to have the specific gene mutation in order for the infant to inherit cystic fibrosis. Some of the symptoms include frequent lung infection, wheezing or shortness of breath, poor growth and poor weight gain, a persistent cough that is often liquidy sounding, and then salty tasting skin. And the most common symptoms are the poor growth and poor weight gain due to a certain enzyme that affects the kidney and other organs. That is also a symptom that goes along with it. So, impact of the aging process on performance. The symptoms worsen with age. The older the individual, the higher the risk for lung obstruction. And most individuals with cystic fibrosis do eventually pass from lung blockage. And then interestingly, some individuals remain extremely healthy throughout their childhood. And then once they reach their teenage years and older adulthood, they become more ill and their symptoms increase rapidly. So the medical prognosis, individuals in the United States are expected to live longer than 40 years. However, the median life expectancy worldwide is only 36.9 years. The age of diagnosis, the clinical presentation, the severity of symptoms, all of those play a vital role in the survival rate of patients with cystic fibrosis. So common medications and or surgeries. Mucus thinners are prescribed to thin the mucus in the airways, allowing individuals to cough phlegm out of their lung, avoiding blockages. And those are often prescribed as like an oral medication that the individual would take each morning, maybe after lunch or at night. And then nebulizers are often prescribed to individuals with cystic fibrosis. They turn medications into a mist that the patients can inhale, and they loosen up the phlegm, allowing the individuals to cough that phlegm out of their lungs. And then a possible surgery I found was a lung transplant, but those are only available for individuals with severe symptoms who probably are already experiencing blockages. And then of course they'll have to go on a waiting list, and it's a very long process. So that's a really difficult option. So for current research, the first research article I found was called Cystic Fibrosis Causes. The causes of cystic fibrosis are inherited by mutation in a gene called the cystic fibrosis transmembrane conductane regulator gene. This gene provides instructions for proteins in every organ that make mucus. The mutation causes the mucus in the organs to become sticky, which can cause blockages and infections in both the digestive system and the lungs. The next article I found was called Evidence-Based Guidelines for Management of Infants with Cystic Fibrosis. And this article studies the impact of early intervention on improved outcomes of infants with cystic fibrosis. They found that the earlier the individuals are treated with things such as a healthy, nutritious diet and a proper medical treatment plan for them, the better the outcome is for them. They do state, however, that there is little evidence in the effects of cystic fibrosis on the infant population. And then the last article I found was called Cystic Fibrosis NLHBI Workshop on the Prevention of Chronic Lung Disease. The article studies the specific gene mutation that causes cystic fibrosis. The researchers state that the disease is apparent at birth, but they are studying whether or not the disease begins as early as conception. Prevention must be targeted in utero during gene or gene product level as early in life as possible, is what this study states. This study also suggests that if the disease is not in place until birth, then the onset of intervention before the symptoms even arise is the best case scenario for life expectancy rates. So social supports and resources that I found. The first one I found was called the British Lung Foundation. It is a website that gives a complete overview of the disease. It states what it is, how it happens, the symptoms, the life expectancy, treatment options. This website would be a great information for a new parent whose child has received this diagnosis. It gives an easy to understand outline of every aspect of the disease. The next one I found was called Cystic Fibrosis, A Guide for Patient and Family. And this is a book that gives an easy to understand explanation of the disease process, symptoms, etc. A reviewer stated that this is the complete guide for parents and caregivers. So it just gives like caregivers' perspective on the disease, some stories that maybe other caregivers can read and relate to, and just kind of gives them an idea of like maybe some resources that are available, how they handled certain things, things like that. The last one I found was called 65 Roses. This website was created because often it's hard for a child to say cystic fibrosis, so they teach children to say 65 roses instead. This is a cystic fibrosis foundation that raises money to find a cure. The website offers resources to help families find care that their child needs. They also offer help to families financially and help them navigate insurance issues. And then you can join this website as like a membership and pay monthly, and they raise funds for the research to find a cure for cystic fibrosis. The evidence-based article I found was called Early Aggressive Intervention in Cystic Fibrosis. This article studied several different medical interventions and the effect on the symptoms. The study showed that there was a significant increase in the life expectancy the earlier the medications are prescribed. However, there is little evidence as to which intervention method is most effective. There's a lack of ability to describe the disease and all of the effects of the disease. However, the increase in research on medication has improved the overall function and quality of life for individuals affected with this disease. Okay, for my interview, I interviewed a 13-year-old girl who was diagnosed with cystic fibrosis at 3 months old. The most important thing that I took away from this interview was that this disease really impacts her life overall. She talked about, she has to take her medication every morning when she wakes up. She does a breathing treatment in the morning when she wakes up and at night before she goes to bed. And then she wears the vest each morning. And she talked about how, like, when she goes to have a sleepover with a friend, she has to take all of this equipment with her. And she said that her friends are obviously really understanding and know what's going on, but she said it's just crazy to think about how, we just pack a bag and go to our friend's house and she has to pack all of this extra stuff and she can't forget anything. And she also talked about how she's much more susceptible to illness and how she has a persistent cough that often people look at her like, you're sick, you need to stay home. But she said that she tries to talk to people about why she coughs and what it means, so that people aren't afraid to interact with her. I asked her about whether or not she participated in a support group, and she told me that individuals with cystic fibrosis are contagious to each other, so it's difficult for them to meet in a group together because if one of them has something, it's much more likely that they'll give it to each other than if she were to interact with the general population. So really like a group that she can meet with is very unlikely for her. But she did state, however, that she's really into theater and she plays soccer, and she said that her doctor thinks that it's really great that she runs and keeps her lungs active. So I thought that was really interesting because, of course, the symptoms are shortness of breath and wheezing and coughing, and I would imagine that running up and down a soccer field, that would be extremely hard, but she does it, and her doctor says that it's really good for her. So I thought that was interesting. Okay, and then I do have a video clip.
sometimes it can sort of interfere. Say if I want to go out but I'm not feeling too well, then obviously I need to stay home and I need to get extra medication done in order to stay on top of my lungs, because if it starts to deteriorate, it's a lot harder to pick back up than it is to maintain it.
I was 30 when Beth was born, and at that time the life expectancy for cystic fibrosis was 31. So I can remember thinking, I haven't done everything I want to do. I've got 3 young kiddies, and actually my life's supposed to start, you know, with the family and all the rest of it, and this isn't what I want for my children. Beth was diagnosed with cystic fibrosis when she was 6 weeks old. She was born at home and was quite poorly right from the outset, but as we had 2 older children that both were healthy, we had no idea that cystic fibrosis was in our family, which is quite common. My husband Graham and I both carry the faulty gene, so we had a 1 in 4 chance of any of our children being born with CF.
It affects the majority of your organs and your body, mainly involving the lungs, so you get a build-up of thick mucus in your chest. It's a lot harder to clear, and it sort of sticks a lot more than the average person would. Also, my pancreas, it doesn't produce the right enzymes that you need to sort of digest all your food and fats within the food, so I have to take tablets as an artificial enzyme. They will digest my fat. At Great Ormond Street, I was asked to go into a research program investigating sort of the effects of exercise on CF and on lung function in CF patients.
The first time I saw Beth, she was very nervous. She was very shy, very quiet. Her fitness levels weren't the best, if I'm deadly honest. She would have to pause within 3 to 5 minutes, and have a break. Now we're able to constantly train for 10-15 minutes without having a break.
Okay, and so that video just shows an individual with cystic fibrosis and how it affects her everyday life, and how she is finding ways to cope and finding ways to make her symptoms much better. And then my last slide is just my resources slide. Thank you.